This is Barbie Levine, and she is a certified prenatal massage therapist and an infant massage therapist, and she's going to explain to us today the benefits of getting massage before you have your baby, and perhaps even the benefits when you have your baby or after you've had your baby. Thank you, Barbie, for being with me today.
My pleasure.
Barbie, why massage?
Massage is a wonderful way to release stress, to bring in relaxation, and for a mother to get in touch with her child that she's carrying.
Can any woman come in here that's pregnant at any month, or at what point do they start coming in here?
Good question. I will only massage once a woman has completed her first trimester. Once that has taken place, there are questions I need to ask and learn about her. One, I need to know, is this her first pregnancy? And if so, I congratulate them. I need to ask them when they're due, and also are there any complications that they've had, and if not, do they themselves have any medical conditions that I should be aware of? I want to know whether or not they're under 20 or over 35, because that's important. That would be considered a high-risk situation. I would want to know, do they have any heart conditions? Do they have any liver problems? Do they have any hypertension situations that are taking place? All these things are considered a high-risk situation. If that is the case, and even multiple pregnancies, if that's the case, it's not that they can't be massaged, but what's important is that they need the communication with their OBGYN or midwife to see if they would agree that a massage would be safe for them. And if so, then I would need a written release form from the doctor. And that's how I work it.
So it's not just, I want a massage and you take them.
No.
There are certain factors that are involved in getting massage.
Absolutely.
And there's safety also that has to be considered with the pregnant woman.
Absolutely. And even a woman who comes to me for the first time, I do a testing called DVT, which is deep vein thrombosis. Mm-hmm. And it's gently by palpitating on one leg either side to see if the temperature is the same on either side, okay, which is what you want. If one side's hot, one side is cold of the same leg, that's an indication that perhaps a blood clot could be released. Not necessarily going to happen, but a possibility. The other sign I check is when I place my hand on top of their knee and their leg is straight out, I will flex and point their foot. If they have any pain in that leg from doing so, that's another indication. And once again, I stress to my mom-to-be that just because I'm testing them for this doesn't mean it's going to happen.
I think it's important for people that are watching to know that massage therapy is not just about manipulating the muscle or squeezing the muscle. There's so much more involved there. There's a release of tension, there's a release of stress, and as you were saying before, emotional things come up, and the massage therapist has to know how to deal with those emotional things up to a certain point, unless they've studied some type of counseling in the past. And I know that a lot of massage therapists are very, very well versed in many different areas, as you are.
Yes, yes.
Do massage therapists ever massage a woman while she's already in labor or while she is having her contractions? Is a massage therapist allowed to be in a hospital in the year 2010?
Of course, you have to get approval, but okay, yes, that is possible. Have I done that? No.
Okay.
Mine is just within my own home, because I can control what I want to give to the women, which is a safe haven for them to feel as comfortable as they can to relax and let go. Mm-hmm. And so I've created that here, and it's very hard to duplicate that someplace else.
Let's talk a couple of minutes about infant massage. And once the baby is born, why is it important to massage an infant?
It's a great question. Let's go back to while a child is within the womb, inside the woman's body, every time the woman is moving, the child's in a confined area. So the movement makes them hit the walls. That's a form of touch for 9 months. Then contractions take place, and they go through the birthing canal, and that takes hours. But all those contractions, another form of touch. Then they're leaving this noisy, but also warm environment, and they're born into this vast space, bright lights, and it's not the noise that they're upset about, but it's temperature, and all of a sudden they may be swaddled, but that's it. There's no touch.
Mm-hmm.
Not as much as they're accustomed to.
Yes.
So that is one of the reasons why touch is so important. Also, it is a beautiful way of bonding with your child. Many fathers are nervous about touching a newborn. It is a fabulous way for a father, and the bigger they are, the faster they falling in love with their child. And although they may be nervous when they're first here, within a short period of time, you can see the relaxation take over, and you see the joy coming out of the father towards their child. And when you do massage a baby, there's so many numerous health benefits for them. A child could be born full term, but yet their intestinal tract may be sluggish. Massage helps to tonify the intestinal tract, which helps to make the food go through the intestinal tract easier and be eliminated. There's some babies who are born with colic. They're labeled colic, which means gas problems most of the time.
Mm-hmm.
There's a special routine for that to help to relieve that. And if you're consistent, that could diminish within days or 2 weeks. Every child's different. It helps the central nervous system. It builds up the immunity. It makes the blood flow and the lymph fluid flow back into the heart easier. Their respiratory systems work better. Every system in the body works better.
There's a lot of benefits into infant massage.
Tremendous benefits.
Is it complicated to learn infant massage? If somebody that's watching says, well, wow, this really sounds like something I would like to do for my baby, and it sounds like everybody should do something like this for their baby. Is it hard to learn infant massage?
Not at all. Not at all. You can come to me. It'd be my pleasure to teach you. I just love what I do. It is just the most rewarding situation in seeing parents who are excited to know that they can help their child when the child needs help. If at a certain time of the day your child goes from a sweet child to a screaming meanie, that means that 1 hour prior to that set time that is typical, they go off, let's say 5 o'clock, this isn't the child that you've known, and you don't know what to do. Then at 4 o'clock, 1 hour prior to that time period, you give your child a bath, and then you massage your child. You stay consistent with that for a few days, and your child will learn how to get organized again. They don't know how to get themselves organized once they're once they're disorganized.
Mm-hmm.
They need help, and that's what the combination of a bath and a massage will do 1 hour prior to that time period of them losing it.
Beautiful. Is there anything you would like to say to the pregnant women that are listening to you today?
I wish you a joyful pregnancy, and I hope you are wise enough to give to yourself. We are so busy as women giving to others that you need somebody to nurture you during this time period. You will be a happier mom-to-be, wife, and maybe already a mother, and it would be my pleasure to be able to help you.
Thank you so much, Barbie, for being
My
with me
pleasure.
today. And I have learned so much, not only about massage, but infant massage.
Oh, it's a gift. Infant massage is a gift of a lifetime. You are giving your child not just a way to relax, but also teaching them that they are loved, that they have such self-esteem that you're giving them, and that it's positive touch, which every child should experience.
Beautiful. Thank you again.
My pleasure.